8 or 9 months.
Now, what about the next sort of touch point, walking? What do parents need to be concerned about when it comes to their kids taking those first steps in terms of their feet health? There's obviously other issues going on, but in terms of foot-related problems, what kinds of things our parents should be looking for?
Well, this is where shoes really start to come into the picture. Up until walking, children really do not need shoes. They should be in something nice and flexible, like a Robies or something that doesn't constrict the feet too much. When they start walking, they do need a good solid base to walk on, and they should be fitted properly for those shoes. That's one of the most important things I tell my parents, is that at age 1 or walking through about age 2 or 3, their feet need to be checked almost every 2 months, because children's feet can change that rapidly. Often what you will see when a child starts to walk is an in-toeing or turning in of the feet, and that should definitely be checked out. That can come from the feet or from higher up in the knees or hips. Definitely needs to be checked. You also want to check for any signs of ingrown toenails, which can happen when shoes are too tight, or also start to happen when they walk because of abnormal pressure in the area. Another thing to watch for when children start to walk, or rather when children do not start to walk, a delay in walking really past 15 to 18 months is really something to be of concern about, and to have a full checkup by both a podiatrist as well as a pediatrician.
What kinds of problems do you see in those kids that aren't walking as quickly as most kids of a normal age like that?
Well, a lot of times it's simply a developmental delay. Children with a lack of motivation to get up and get something, such as children who come lower in the birth order and have lots of siblings who will bring them everything that they need. But unfortunately, sometimes it is a more severe problem, like a muscular dystrophy or a spina bifida that maybe has gotten missed along the way. Luckily, with modern medicine, those things are typically diagnosed much earlier.
Right. So, moving on up past the age of walking, past a toddler stage and into elementary school age and even sort of pre-teens, in your practice, you're starting to see a lot of problems with kids. And again, half of your practice are kids of all ages, right?
Right.
Do you see mostly sort of young kids, elementary age, pre-teens in your practice for the most part?
Pre-teens are more common. That's really when children start to get into sports activities very vigorously. We're starting to see kids do travel sports and more activities at an earlier age. It used to be very unusual for children to be in activities 3, 4, 5 days a week, and now you see kids with 5 or 6 soccer games or baseball games on one weekend. So we're seeing a lot more of the sports injuries, or what we refer to as overuse injuries, that typically we weren't seeing until adulthood.
And what kinds of problems do overuse injuries cause? Because kids and parents have sort of conspired to create this problem. We don't want our kids to be obese. We want our kids to be working out and be active. So maybe we go overboard, but as parents, we're sort of we hear these messages from the media and from our physicians and other folks that say, well, our kids aren't active enough, so that we kind of go overboard the other way. And instead of just one soccer team, they're in 2. Instead of one baseball team, they're in a regular baseball team and a traveling team, for instance.
Right.
So what kinds of overuse injuries do you see that are common?
Well, first, I'd like to say that activity is the benefits of activity far outweigh the risks. So even though we do see these injuries, they can be easily treated, and they can continue to train and get back to activity in an expeditious manner if seen by the right doctor. But a very, very common thing that we're seeing in kids is something called calcaneal apophysitis. I'll give you that one. This is an inflammation of the growth plate at the heel. And if you could point to right where that arrow is pointing, yeah, that little white band there is the growth plate of the heel. And a lot of times if people see that on x-ray, they think it looks like a fracture or broken bone, but it's actually not. It's meant to look that way and look jagged in that way. But the Achilles tendon, which is that tendon right up on top there, has a very strong pull. And in a lot of children, when they train for these sports, they get very tight Achilles tendons, which pulls very hard on that area, and then that growth plate gets a little irritated. This is was very commonly seen in kids between the ages of 10 and 12, and now we're seeing it extend as early as 7 or 8, and in past into the teens. This is something that is definitely one of those problems that the earlier it is treated, the better. A lot of parents will say, oh, it's just growing pains. I really personally do not believe in growing pains. I think no pain is normal. And if children do complain of heel pain or any pain with shoes, they want to take their shoes off, they don't want to participate in activity, maybe a sport or an activity they loved before they no longer want to do, it's really important that you get them in and get them checked out, because these problems are treated so easily in the beginning. And when we see children who've had them for 6, 7, 8 months, it can be really difficult. Kids with a inflamed growth plate can end up in a cast.
Is that a common treatment for these overuse?
The casting is sort of a last-ditch effort, but we do get children to the point where they are so inflamed that the only way to get them to take it easy is to put them in a cast to slow them down.
Okay, we do have a caller for the first time. Good evening, welcome to Feet Forward.
Oh, good evening. I would just like to know, what do you recommend, what type of shoes or brand shoes do you recommend for someone that have a lot of problems with their foot? Because my daughter, she have foot problems, and I would just like to know what is the best brand shoes that I could buy for her.
How old is your daughter?
My daughter is 14.
Okay. That's really getting into an adult shoe, and some great brands. New Balance is a fantastic shoe. You can find them in a variety of stores at a variety of price points. It's really a great shoe. The key is, and especially as you get into those teen years, really no flip-flops. Flip-flops really do cause a lot of problems, a lot of fatigue in the feet, a lot of weakness. What you want to look for is anything that's really supportive. So when you look at a flip-flop has really no support. When you bend that shoe, you're going to see that it bends virtually in half. So when you look at a shoe, you really want it to bend. You want it to bend gently, but not completely. So you don't want it to be very flip-floppy, just like a flip-flop got its name. You also want to look for support through the arch and a support up through the such as a tie shoe. The other thing you want to look for is something that has some sort of either heel or some sort of strap that holds the heel in, because that's going to keep them well seated in the shoe and they won't be falling out of it.
Okay, thank you for your call. And for the other viewers, the American Podiatric Medical Association does have a list of seal of acceptance products that meet certain rigorous standards. And for those of you who are interested in finding out more about that, you can go to the APMA website, which is www.apma.org, and you'll get a list of seal products, including shoes that get the seal of acceptance for kids too.
Definitely.
So we were talking about overuse injuries, and that's one of about 3 or 4 injuries that you see commonly in kids. What are some of the other kinds of problems that you see commonly in your kid patients?
Probably one of the most common things that parents...
Hold on, let's get this caller first, and we'll get back to that.
Sure.
Okay? Go ahead, caller. This is Feet Forward.
Hi, this is Drew.
Hi, Drew.
I have 3 boys. Hello?
Hello?
How you doing?
Good, how are you?
Good. You answered part of the question earlier. I'm struggling to find out the problem my 2 sons are having. The one is 8. He's fine, has no foot problems. The other 2, I don't know if it's growth spurts or not, but sometimes they have such pain, I don't know what to do, and besides taking them to a doctor, they walk kind of funny. I don't know if that's because they're coming